We are joined by Mr. Dhananjaya Reddy, Chief Executive Officer of Aarogyasri. Thank you so much, sir, for joining us. Let me begin with, you have worked in the various departments of government of Andhra Pradesh. You were in municipal administration also for some time, and now you are Chief Executive Officer of Aarogyasri. So how do you look at your career so far?
Yeah, it's a very satisfying career. In the municipal corporation, I got an opportunity to deal with the cutting edge of the administration to start with, and also various developmental activities, because the local body is always in the forefront in reaching to the public, and I'm fortunate enough to involve in various development activities that have been taken place in Hyderabad, be it the construction of flyovers, be it the road widening, be it the land acquisition for the upcoming metro rail, and various other initiatives as far as the planning of the city is concerned, including the master plan of the city.
Let's talk a little bit about your current assignment, which is about the Chief Executive Officer of Aarogyasri. Aarogyasri is basically a project which got a lot of popularity, a lot of potential, and there are a lot of other states which is trying to replicate it. So please tell us something more about the kind of work that you do, the kind of challenges you are facing.
Yeah, in fact, the new assignment that I am holding is the CEO Aarogyasri. In fact, this is the one scheme which is a novel scheme initiated by the government of Andhra Pradesh in the year 2007, and got so much of popularity and reach also. It has reached almost 84% of the population, and created a sort of confidence in the minds of the public that there is one scheme which will take care of my health needs. That is the goal that has been reached by the scheme. And in fact, this has become a model scheme for the whole country, and many states have started following this model with a little bit of variations. So therefore I can say this scheme has become a role model for the entire country as a whole. And in fact, this is one of the government initiated scheme, maybe one of the best schemes in the world, I can say. But at the same time, in order to reach the people, and the deserved people get the deserved treatment, we need to have so much of modalities that have to be worked out. Of course, an efficient system has already been worked out, and with cutting the costs, and we have made the system mostly IT enabled. In fact, it's 100% IT enabled system. I can't say mostly it is 100% IT enabled system with the web-based IT solutions available, and which resulted into the transparency in the system, which resulted into the cost cuttings into the system, which resulted faster movement of the processes involved in the system, and also brought the inherent efficiency in the system. So that has made the system much more systematic, and the outreach of the system, the program is so good. And though the initial criticism was there about the system, that the government has coined the system to benefit the private hospitals, but now cutting across the spectrum of the social fabric, so everybody is appreciating the system, because the hapless poor patients are getting the treatment without spending even a pai of rupee from their pocket, and it's totally cashless, paperless scheme as far as the process is concerned. But there are challenges in the system because of the volumes that are involved, and because of the number of network hospitals that are involved, and there are certain procedural lapses as well as the certain deviations in the system. So we are trying to plug those loopholes and try to make the system much more foolproof. At the same time, bringing in much more accountability, not only from the Aarogyasri Trust point of view, also from the hospital's point of view also. And in order to meet the gaps between our expectations and the aspirations of the hospitals as well as the patients, so we are continuously working out various processes that involves the updation of the patient details, that also involves a revision of the rates, that also involves some processes improvement as far as the trust is concerned. It is a three-pronged strategy so as to work out a wholesome solution for the entire scheme.
Thank you so much, sir, for your time.
Thank you.